Hi, my name is Matole Champon, and I'll be presenting on the rise of superbugs, specifically methicillin-resistant Staphylococcus aureus, shortly known as MRSA. An overview of my presentation, I'll talk about the background of MRSA, transmission, signs and symptoms, diagnosis, high-risk groups, prevention strategies, and case management of MRSA. So on the background of MRSA, the misuse and overuse of antibiotics, for which most of us are guilty of, has resulted in the emergence of superbugs. What are these superbugs? Superbugs include MRSA, as will be discussed later, Clostridium difficile, and multi-drug resistant tuberculosis. MRSA is a strain of Staphylococcus aureus that is resistant to multiple beta-lactam antibiotics. MRSA emerged over 55 years ago. Staph aureus, of which MRSA is a strain of, is a common normal human flora found on the skin surface, nostrils, and throat. About 33% of the population carry Staph aureus as normal flora, while 2% carry MRSA. MRSA infection can occur in a hospital setting, known as healthcare-associated MRSA, or within the community, also known as community-associated MRSA. Transmission. MRSA is spread via skin-to-skin contact with infected persons through contact with contaminated fomites such as towels, clothes, and surfaces. Healthy people with MRSA may be asymptomatic. Nonetheless, immunocompromised patients are more susceptible to MRSA. Symptoms of MRSA may start as red, swollen, painful bumps that look like pimples or spider bites, which may occur with fever and pus drainage, as seen in the photograph at the bottom. Symptoms may progress to an abscess and can be life-threatening when the bacteria enters the bloodstream, affecting heart valves, lungs, and bones, and leading to sepsis and eventually death. Diagnosis includes swab screening, where a cotton swab of the skin is done to test for MRSA bacteria, and a laboratory confirmation, where bacterial cultures of blood, urine, and sputum samples are done. So high-risk groups for MRSA include 1. People living in crowded places with easy skin-to-skin contact. Who are these people? College students in dorms, athletes in locker rooms or gyms, homeless shelters, and prisons. 2. Immunocompromised persons, and these are HIV/AIDS patients, diabetic, cancer patients, and transplant patients. 3. The elderly. 4. Persons admitted at a health facility for a long period of time. Research shows that people living in the hospital are at most risk of being infected with MRSA, in that condition known as healthcare-associated MRSA. 5. Veterinarians and persons in contact with livestock or pets contaminated with MRSA are also at risk of getting infected with MRSA. Prevention strategies. This includes creating awareness about MRSA among healthcare workers and the general public, public education on hygiene practice to reduce spread. Also, CDC has made these guidelines for healthcare workers to help improve hygienic conditions in the hospitals and prevent MRSA spread. Screening for MRSA before admission in the hospitals and subsequent treatment with antibacterial soap and shampoo to prevent spread of infection is done in the UK. Reducing the use of antibiotics such as quinolones and cephalosporin is also necessary. Treatment for MRSA is challenging. However, MRSA is not resistant to all antibiotics. Immediate treatment with MRSA-susceptible antibiotics is recommended, and these biotics include vancomycin, sulfur drugs, and tetracycline. I hope you enjoyed this presentation, and this presentation gave you enough information about the superbug MRSA. Thank you very much.